You are not actually being tested in nursing school on what you memorized. So let that sink in because you're probably thinking right now, Nicole, you're wrong. Obviously, I need to know, I need to have this stuff memorized. But that's not the case. That's not the case. Because you could literally, if you had like a photographic memory, you could literally memorize every word in that textbook and still not be able to answer the questions on your test. The first thing that you do need to memorize is the part that gets skipped by almost everybody. It's how to think about normal. It is what is normal. So instead of focusing on trying to memorize like all of the signs and symptoms and complications and side effects and nursing care, we want to start with memorizing normal. But the difference is I do not read them like it's Pride and Prejudice. I don't read it like it's a Jane Austen novel, okay? Textbooks are meant to be read like a dictionary, not a novel. And the way we read a dictionary is we open it up, we say, we have a question in our mind, like, how do I spell this word? We look it up, we figure out how to spell the word, we get our answer, and we close the textbook and we move on, or close the dictionary and move on with our day, right? So instead, we just have to go back to this question based format of studying, which is what I teach with the Silver Bullet study system. And you start with that question number one that I told you about with the memorization mistake, which is what do I need to know about normal before I can begin to understand uh, this topic that I'm trying to study. And then from there we just ask more questions. You know, in nursing school, the better you get at asking the right questions, the better you get at learning to think like a nurse.